Thank you very much, Mr. Master of Ceremonies. I want, in the interest of time, to adopt the protocol so ably led before me, save and accept to acknowledge the presence of members of our new cabinet and allow me to introduce them again to you and to give each of them a special hand of welcome. The Honorable Jean Hamilton, could you stand? And we have the Honorable John L. Powell, could you stand? We have the Honorable Akila Byron Nisbet. We have the Honorable Wendy Phipps. And the others on their way before the rain comes. I want, of course, to acknowledge the senior government officials who are here, in particular our permanent secretaries, and I must mention Dr. Dolores Stapleton Harris, the permanent secretary in health, Mr. Vincent Hodge, the permanent secretary in education, could you stand? And permanent secretary Elvita Brown in sustainable development. Mr. Petty was somewhere here in national security, but to all who have come and the representatives of the diplomatic corps, I say a special welcome to you. I want, of course, to welcome the family of Nurse Sylvia Garnette who are here, and I gather they are headed by Mr. Derek Freites and the Freites family. And all those, I want to bid you all welcome to this my hometown village of Tabernacle. And when I was growing up and going to Tabernacle school, they had us repeat and sometimes sing, if you are from Tabernacle, you're a lucky fellow, for there were mangoes and guineas and salsa, and we would identify all the lovely things for which Tabernacle is well known. So I feel especially blessed to be here this afternoon on an occasion like this, at this very health center. I would have come time and time again as a student of the Tabernacle All-Age School then, later renamed the Edgar Morris Primary School. And we would have come here to do many things, to get what we will call our usual injections. Some nurses gave us a terrible hard injection, and some gave us a more comfortable experience. But to all of them, we want to say hearty thank you. And I want to say how delighted I am to see some of my fellow people of Tabernacle, like Nurse Sylvia Isaac, who delivered a couple of my mother's kids here with us today. Give her a special round of applause. I want to recognize Nurse Christine Waltley, who has been here and who married to a young man from here. I want to recognize, of course, Nurse Pam from Sadler's and all those who practice nursing, led at the health center. And of course, now we are delighted to have Miss Buddy right here delivering. We thank her. I recognize, of course, also from Tabernacle, Nurse Laurie, Rona Laurie. We welcome her back to our hometown village. It's really a special delight to have all of you, and I welcome one and all back here in Tabernacle, where it all began for so many of us. I want to say that it is a lovely development that Tabernacle should, as it were, be the first of the communities to benefit from this massive, spacious, lovely, comprehensive health facility here. And I thank Senator Wendy Phipps and the team who had worked so hard to bring this to fruition. We had expected it to come earlier, but now it is finally here, and for this we say to God, we give the glory. Being able to get health care you need, or one's family needs, will make a difference in our lives. And for too long you have heard the conditions under which healthcare services were delivered here at Tabernacle were unacceptable. I am happy today that we can restore our health facility to its rightful and historical important place in Tabernacle. And I am happy that caregivers and recipients of healthcare services will no longer be confined to the basement of the Tabernacle Daycare Center. We have now found more suitable space for the people of Tabernacle, the people of Bellevue, the people of Mansion, which are the primary feeder communities for this facility. Sorry. I believe that this facility is yet further proof of how seriously the Team Unity government takes the health and well-being of our people. And I feel especially good to know that someone who labored long and hard in the health center is today being honored by having this facility bearing her name. And that person you heard Senator Phipps said is none other than Nurse Sylvia Garnette. I want to thank her for her excellence. This British-trained registered nurse and midwife excelled in the delivery of health services in our health centers, Tabernacle, Molyneux, Keon, etc., and eventually as a matron or assistant matron at the JNF Hospital. We want to give her thanks and give God thanks for using her in this particular area. Give Nurse Sylvia Garnette a special round of applause. And as I just reflect back, having to walk from all the way down the street to come up here, my mother had a way of delivering babies only in the nights. And usually it was me who was being called to go and get the nurse. And so I had to come all the way this long walk, it appeared then, to go over there to call Nurse Isaac and to say my mother was having a baby and she would like you to come. And equally I recall when my sister Coretta was being given birth to, I would reach to Molyneux to fetch Nurse Sylvia Isaac. And she said, what happened? I told her. She said, I already knew. I said, how come? She said, your family chippy came in the dream, and he told me to get ready to go to see Tanti. So I owe a lot to all the nurses, and I want to ask you to give them a special round of applause and appreciation. We have made quite a lot in the delivery of healthcare services in St. Kitts and Nevis, and yet there is still a lot more work to do, work that we as a government and people are committed to do. We will always work hard to improve our healthcare facilities in keeping with our commitment to delivering the stronger and safer future for you, the people. And some of the projects that we have planned include the construction of a brand new general hospital at a new location in West Barstow. We have planned the completion of the cardiac unit at the JNF General Hospital, and this should be happening, CMO, is it this year or next year? We should have this in place. This year, and we are holding her to that. But this is important in the context of the conversation you've been hearing before. And the new Minister of Health spoke to the NCDs that are impacting upon the quality of life in St. Kitts and Nevis and within the region. Indeed, from since 2007, the region came to the realization that our greatest health challenge was in non-communicable diseases. The diabetes, the hypertension, the heart attack, the obesity, and all those things. were at the heart of our problem, at the fulcrum of issues to do with mortality and morbidity. And way back in 2007, the leaders then went to galvanize in support of the international community to get NCDs on the front line of the conversation among health planners all over the world. And that is why today we are saying that our primary health sector, our community health, must be at the forefront of the fight for NCDs. And in this regard, I want to recognize Nurse Christine Watley, of one of those community nurses who have spent a lot of time and given a lot of support to the fight against NCDs. Nurse Watley, could you stand and we give her a special round of applause, and all the other nurses and health practitioners who have been working in this regard. We, of course, have put important emphasis in our second term on the build-out of our national health insurance program. Senator Byron Nisbet spoke to the need to have health care for all. Health care for all is an ideal that has to be supported by significant interventions. Health care for all we have been practicing so that our people can come to our health centers and get free care. But there are a number of other infirmities, ailments from which people suffer, for which they need add-on support. And as part of our policy to ensure affordable health care to every citizen and every resident, we have come upon the idea that the time has come to deliver a national health insurance program. And we have asked the Honorable Gene Hamilton to bring his experience as an insurance man to help us with the build-out of this as rapidly as possible. We need this to ensure that whether you are rich or you're poor, when you fall sick, you are able to access the health treatment that you deserve. Team Unity will deliver this for you. Additionally, we want to build out a permanent quarantine facility. And we are hearing a lot these days about quarantine facility. We know we have them, but we have never been prepared to quarantine large numbers of people. COVID-19 dramatized that important absence in our country of quarantine facilities. We are saying going forward, as part of the plan for the stronger and safer future, we will deliver for St. Kitts and Nevis the first modern state-of-the-art quarantine facility. And so any other disease that would come, whether it is COVID-19 or something thereafter, St. Kitts and Nevis will be better prepared than we were for COVID-19. Yes, as part of our plan for the safer and stronger future, and recognizing the important challenge of NCDs to the stability of families, to production and productivity in our country, we want to address the problem of renal failure in St. Kitts and Nevis. We have a hemodialysis facility at the JNF, and yet we know it is much too costly for ordinary people. It is much too costly for even those who are at the middle income and higher middle income level. I am advised that the usual process of the hemodialysis treatment is around 2,000, somebody help me, 24, well, let me say it as I know it, 300 US, 800 EC per treatment, and you are required usually at least 3. So that's $2,400 a week. But some of you not even getting that amount. $2,400 per week, multiplied by 4 weeks, an average per month, you get something like $9,600. That is significant. And that tells you a number of things, one of which we must prevent it from happening to us. We must prevent it from happening to us. And one of the positive things about NCDs, they are lifestyle diseases. In other words, if you change your life, you can prevent it. If you change what you eat, you can prevent it. If you change what you drink, you can prevent it. Less alcohol becomes important. More money in your pocket, unless you have worries in meeting your child support payments. Positive. Life changes. Less salt in our food. Less sugar in our drinks. All of those things can help us to have healthier lives. And importantly, the exercise becomes important. And when you think of the massive challenge to our well-being and our wellness of all these NCDs, and you look that the power lies in you, you wonder why is it that more people are not paying attention to their health. And one of the good things, of having the COVID and having the lockdown was that people learned to drink less alcohol. Less alcohol. Because the license was suspended for a while. And people managed to cope. And I want you to continue the habit of drinking less for your own good. Lifestyle changes can make a significant difference in the quality of life we allow ourselves to have. Same with the salt, same with the sugar. We can make a difference in those things. And we are being advised at the level of the government that we should introduce taxes on sugary foods and salt products, so that if you want them, you pay more, and hopefully that becomes a disincentive. Barbados has done that. Dominica has done that. But for me, as a finance minister who is yet to introduce a new tax, I want you to do it of your own volition, so that we are not forced to come to tax your sugary products, tax your salty food, and tax your alcohol. We could well do without a taxman in the country, but it all depends upon you. So I'm encouraging you with respect to that. Part of the future plan is that St. Kitts and Nevis will invest more in specialist services by our medical practitioner. And of course, we will invest more in our nurses and all those who provide care to patients and generally provide good support to all our health workers. I want to charge the policy developers and the leaders of the public health care system to be creative and innovative in program and service development to attract young people to the primary health care system, not only to provide preventative care, but also to help them nurture a level of emotional intelligence to build their resilience and establish networks of support. There is a consensus in the evidence-based literature that promoting resilience in young people enables the development of good personal life skills, helping them to sustain good relationships and assist them to consider appropriate interventions to ameliorate or prevent the effects of setbacks. The young people who have exhibited such great talent and creativity in St. Kitts and Nevis over time, and for me, most impressively, during our recent general election campaign, must be assisted with the skills, not only to have caring relationships with adults, but also a repertoire of skills to cope and navigate the challenges that life will bring to them. And in this regard, in our manifesto, we have outlined a new ministry of entertainment, entrepreneurship, and talent development. And we have given that special challenge to our new Minister of Health, Senator Keela Byron Nisbet, to flesh that out, to bring new soul, rhythm, rhyme, and reason to the quality of life of our young people all over. The Honorable Minister of Health, Correction, Force of Habit. As we focus on our young people, we have to help them make the right lifestyle choices that say no to obesity. In the good old days, you have a child very fat, parents love that. I used to hear some people say, you see how fat and big he is? When he's sick, he has something to withstand that. Well, the new science is suggesting that being so fat may not be the best thing. Of course, there are genetics and other factors, and so on and so on. So again, we want, as a general rule, for people to control their body weight. We want to be a society that doesn't overly consume alcohol. We want to be a society that have a small percentage of people engage in smoking and other behaviors that can lead to non-communicable diseases of a chronic nature. It is our responsibility to provide the people of St. Kitts and Nevis with a stronger and better future. And we will do it not just as a government, but as a people working together. While the Team Unity government has promised to build a new hospital and is building out a cardiac unit which will be state-of-the-art at the JNF hospital to treat with cardiovascular problems, while we have an oncology unit at the JNF hospital to treat with cancer, we want at all costs to mitigate, to minimize against hospital admissions. And that is why then the community centers, the primary health care must be where we must put our major investment, because if we succeed there, less people end up going for the second level, going to the hospitals and being admitted there. So that will continue to be a priority. Nurse Irish, you must help us, and the health promotion unit must help us. And we need all those involved in communications, the radio talk shows, everybody to be sensitized that we need a healthy St. Kitts and Nevis, because the health of the nation determines the wealth of the nation. Unless people are healthy, they can't give their full contribution to work, to productive activity, and that becomes a burden, because less persons who are there working, less money for Social Security, less pension benefits would become available, and the science of large numbers which guides insurance policies, that becomes even more challenging. We want every able-bodied person to be able to contribute productively and gainfully to the St. Kitts and Nevis which we are building out. And we call during the campaign how readily I seize upon Marcus Garvey's iconic address in 1937 when he encouraged us as a people, go build a Garden of Eden for St. Kitts and Nevis. And when you think of the Garden of Eden, you're not just thinking Bible, you're not just thinking church, you're thinking of something very special. You're thinking of something tasteful. You're thinking of something fulfilling. You're thinking of harvest, bountiful, where you know no need, you know no want, because all is being taken care of. That is what I still continue to have in the mind of the young people of St. Kitts. I am going to carve out something good that will be my Garden of Eden. I am going to take a unique step in some area of human endeavor that advanced St. Kitts and Nevis further and farther than anywhere it had gone before. That is how we build strong, powerful nations worthy of their name. And that was what way back in 1937, Marcus Garvey was appealing for us to come with new ideas. He said St. Kitts was the most beautiful country in the world. I still believe so. I love my St. Kitts and Nevis. But Marcus Garvey said, I come here not to steal anything from this lovely country, but if I were to steal anything, it would be ignorance. How powerful that is. Take away the ignorance of the people. Take away their not knowing. Give them a better condition of knowledge so their creative juice can be used. Give them a sense of their value and their place in history, so they look beyond that history to a future of success and development of themselves, of their families, of their community and their country. All great countries have done that. The young people of Edgar T. Morris at Estridge School and all over St. Kitts and Nevis must want to advance further than their father did. They must want to advance further than their mother did. They must want to advance further than the pastor in their church did. We must not see ourselves limited and constrained. We must see ourselves as a people empowered with an idea, with a thought, with a philosophy of growing better every day. That is what I wish for my St. Kitts and Nevis. And so we are going to be relying upon a strong health promotion and prevention program which will speak to our young people in particular and counsel them regarding diet modification. That's a nice word, phrase for saying, watch what you eat. Watch what you eat. And sometimes it is, watch what time you're eating to. Watch what time you're eating to. Sometimes I get fat because I'm not watching the time when I'm eating my rice. So the diet modification, increase in water consumption, and how important that is to good health. And of course, the program of physical exercise. And I want to say this August will be the month in which we should be commemorating the St. Kitts Nevis moves, which were launched in last year to bring greater consciousness and awareness to the importance of physical activity in our lives. Now, physical activity doesn't mean everybody go run. I remember I met a doctor and I was surprised. The doctor told me, I never run in my life. I said, how come? She said, no, I could not run. I just couldn't do it. So then I begin to understand that everywhere, to each his own. Your physical activity could be walking like I do almost every day. from Tabernacle to Mansion. Sometimes the sun is too hot, so I come up in my very village. I see more what is happening among my constituents. Your physical activity may be going on your farm. Your physical activity may go into the beach to have a swim. Your physical activity may be playing with your children in the morning, in the afternoon. All we are saying, you make the determination. It is your life. Be consistent with it, but engage in physical activity for a consistent period of time, and that is going to help you very much. We want to applaud the efforts of the Enhanced Multidisciplinary Chronic Disease Management Program, and I think the new minister spoke of that. I gather we will see a build-out of increased emphasis on foot care clinic. That is, you come, they treat your foot, they cut your nails and so on. And of course, I am advised that this will help reduce foot ulcers and eventually amputations. Dr. Wilkerson, you know what that is. So all of these things, we can have a better life by paying attention to these. I am informed that this facility is equipped with contemporary teaching facilities to facilitate teaching and continuing health education for practitioners. COVID-19 has forced us to change the traditional ways of doing things. I am pleased that the health team had the foresight to regard with respect to the relevant infrastructure to facilitate virtual teaching and learning here. And speaking to the matter of COVID-19, allow me leave to pay a special tribute to all those health professionals who have served our Federation so well through the unprecedented COVID pandemic. And of course, in every movie there are one or two stars. We well know that Dr. Hazel Laws is a star. And we well know that Dr. Cameron Wilkerson is a star. But so too are all the other health workers and practitioners. So everyone here who is in any aspect of health, I ask you to stand, and I ask the rest of us to give them all a hand of applause. Thank you very, very much for your work and for your contribution. You know, we have come to this as an example of a country that knows what to do. We have come to this shining as a country with capable technicians and professional people. We have come to as a country that not just following the crowd, but we have a mind of our own, and we rely on the expertise that is out there for all. That is why when some country was saying they can't close down, we say we better close. That is why when the cruise ship came, we say we are not going to allow them to come off. Other countries were prepared to let them come off, and we see what happened. I am so proud of our health people, our professional people in St. Kitts and Nevis who have worked with us. And now all over the world, they are looking to St. Kitts and Nevis as an example of what to do and what not to do. And I want to thank all of you and say, while we are doing these things, and while we are becoming a little bit anxious about the future and the opening up, let us take time first to give God thanks. We have no deaths, no hospitalization, and those who have been affected have recovered so nicely. And let us not show caution to the wind. Let us still respect the professional advice given to us, because that has kept us well so far. And we are not doing so badly. In America, they don't know how to open up as powerful as they are. In St. Kitts and Nevis, we are doing it gradually. from 2 days to 4 days to 5 days to 7 days. And we even gone up to midnight when everybody should be off the road. We're doing it nicely. 7 days you now can labor and rest on one of them, Saturday or Sunday, whichever is your Sabbath. We have done it carefully, and you therefore can remain, have a high trust in our professionals and in our government to do the right thing. And we understand, as I said on Tuesday, that ultimately you have to strike a delicate balance. Man must live, but man must live carefully and thoughtfully. And so, on one hand, we want people to go to work so that they can afford the necessities. But you also have to put your health first. For what shall it profit you if you go to work in the restaurant or even in government? You get a couple $1,000 and then the COVID got you lick up. And then you have to go spend thousands of dollars which you don't even have on your bank account. You have to go beg and borrow to get that. We are going to move in a proper way. Our National Emergency Operations Center have persons who are studying this thing, and at the appropriate time, we are going to open up. But as of today, I can say, as I have said so many times, the borders are closed for health reasons. For health reason. So when there is no longer a health reason, the borders shall come open. We have made progress, very good progress, and there is more that is to be done. I am looking forward to the build-out of other health support systems throughout St. Kitts and Nevis. And I am looking forward to attending more ceremonies. One is to come in St. Peter's. One is to come in Connery. One is to come in Basseterre. We have a plan, and we are working to that plan. In closing, I can say to you that my government will never get tired of working hard to improve the lives of our people of St. Kitts and Nevis. And I will never get tired of encouraging and urge the people of St. Kitts and Nevis to look forward with optimism to a stronger and safer future. We deserve it. We deserve this stronger and safer future, and we must work hard to get it. In closing, I am particularly delighted that one of our very own daughters of St. Kitts and Nevis, Nurse Sylvia Garnette, an icon in nursing, is today being honored. She was a trailblazer and a community activist long before that phraseology had become popular. She was a Sunday school teacher in this church just above there. And I give you a joke on it. I used to go because I grew up in the good old days with Rona and them, and you had to go to every Sunday school in the village. What a thing. My family were Moravian, so you go Sunday school in the morning. In the afternoon, you go Brother Brown. Baptists come in the village, you have to go Baptist Sunday school. So many of them. But what was good about them is that sometimes they would give you what we call the treat. Everybody like a treat. So I used to go up there to Brother Brown, as we call it, for my treat. And then the day of treat, we went down to the playfield. Everybody name a call. Everybody name a call. I waited. People in my class name call. They gone on to another class. And when I look, they ain't give me no treat. I told my grandmother I'm not going back to the school. But I've come though in the mature part to recognize that a lot of what has held me and anchored me did not necessarily come from the regular church, but from Sunday school. Sunday school, where we had to go and do our recitations. We had to repeat the scripture without fully understanding them. Later on in life, we come to understand how important the spiritual life is. And so I want to commend all parents. Even if you do not go to church, send your children. Send them to our Sunday school and help them to develop a more comprehensive view of life. Yes, I was saying that Nurse Garnett is well deserving. I would say to you that in my latter life she adopted me as a son, took me to scripture, and helped me to meander many of the difficult challenges of leadership. So I feel especially fortunate to be here today and to be part of this renaming ceremony of the Tabernacle Health Center. And now I take great pride and pleasure in declaring from henceforth this facility shall be referred to as the Sylvia Garnette Primary Health Care Facility. It is now officially commissioned and of course open to do business from tomorrow. May God bless us all, and may we continue to move from strength to strength and be worthy citizens of St. Kitts and Nevis as we continue the journey of this stronger and safer future. Thank you very much. It has been a special privilege for me to serve my own people of Tabernacle in this way. Growing up, I had no idea. In fact, I was too shy to consider politics. I simply wanted to be a teacher, to give back the love and the care that so many of my primary school teachers gave to me. Later on, I wanted to become a lawyer, but it was not to be. The people of St. Kitts and Nevis has given me a once-in-a-lifetime experience to serve the country that I have loved and will continue to love with all my heart as your Prime Minister. And for such a time like this, I promise I will do my endeavor best to serve the people of St. Kitts and Nevis to the best of my ability. And Sister Pansy would help me with the words of Micah. Somewhere it tells us, what does they require of thee? What do they require, Sister Pansy? Yeah? Walk humbly with thy God. So thank you very much, the people of Tabernacle, and thank you to the people of St. Kitts and Nevis.
And thank you, Honorable Prime Minister.